Today we have a wonderful program. We have some experts in mental health who will be talking with us today. JC Adams and Amy Looper, both are CEOs and founders, co-founders of the organizations that they represent. Both have actually had a strong affiliation with Health Wildcatters in the last few years, being in the program, the Accelerator. So very close to the Health Wildcatters mission and working with Hubert Zajac. But my name is Lance Manning, and I'm the director of the Healthcare Challenge this year, and grateful that we're having a wonderful program this week leading up to Friday and Saturday. So what we're going to do is just tell you a little bit of background information about the event. Then we'll hear from our speakers, and then we'll open the floor up to questions. But looks like we got a great crowd, maybe 20 plus here tonight, and excited for your involvement. So first, we want to thank our sponsors who are supporting us in this event, and without their help, we couldn't run the show, and grateful for their continued support. Texas Medical Foundation, IBM, LocuMatch, Atlanta Pharma, and Texas Health Resources, among others. So we have a goal here of this challenge, and for those of you who have attended before a healthcare hackathon or our event, why do we get together like this? Well, we believe that the activity of convening to talk about and brainstorm on healthcare innovation is a creative process. And we know that in the past, there have been business models and companies formed from these types of events, but we want to give our healthcare and technology communities a chance to team up and to work on some of the toughest problems facing the healthcare industry. We invite people from all kinds of backgrounds. You have medical professionals, students, researchers, designers, etc. And in addition to making new connections and having a little fun on the way, there's also the chance to win prizes. So that's really what Friday and Saturday are all about. And tonight we want to give you a chance to hear from representatives focused on one of the themes, and that is mental health. And it's one of the many themes that we are inviting people to problem pitch about. And you can see the rest of the list here, and you can also see this list on our website. This additional list here shows some of the type of people who apply to our events and some of the local affiliations on the right of groups and companies and universities who have attended our events in the past. So it's a great mix of people getting together, and we're having a unique opportunity this time because it's virtual. So we have some wonderful tools to have people meet up and team up, but it's mostly going to be done online, and we're really excited about that. Here is a snapshot of how the week is going so far. We do have some signups for people who want to drop by our 20th floor offices in downtown Dallas to pick up some free gear and get ready for the weekend. That's 2 to 5 p.m. every day this week. And you can sign up through Sign Up Genius, and that's in an email you may have received for those of you who have registered for the program. I do understand that there are some who are on the call tonight who haven't registered, and that's okay. We welcome you to this event and hope that you can spread the word or join us if you like for this Friday and Saturday. The rest of the week, we have other information sessions starting at 6:30 p.m., going for about an hour. And then afterward, we invite those who are registered to join us on the Discord platform. You should have received an invitation to that to sign in and get familiar with the platform, the virtual platform that we'll be using for the Texas Healthcare Challenge. So that'll be the hour after this hour. And of course, Friday and Saturday, some more information on the schedule there, as you can see on the right. That information is also on the website where you hear about the different types of speakers we'll have and the hacking that'll go on. And then finally, we'll end with prizes and speakers and celebrate the wonderful event. So, all right. So real quick, I do want to talk a little bit about what we do at a healthcare challenge. we invite individuals to pitch problems that they want to work on and invite team members to join them. Those who have problem pitch have recorded them and they're on the Discord channel. We invite others who may want a problem pitch and form a team to sign up as well. But you have 60 seconds. You got to be very specific about what you're solving, and don't talk about your solution. So just try to, focus in on the problem that you're solving, and that's really how you get the interest of fellow teammates. And then teams are formed as you network together and find ways where you can help each other. And then as you mesh together, you'll begin hacking on Friday night and go through the next day into Saturday through to the end of the event. And there's probably about 4 to 6 people per team. You want to make sure you have different people with expertise to balance you out, and that's how teams are formed. So the process is pitching, forming teams, mixing, mingling, hacking, getting feedback. In fact, we have some wonderful mentors that will help give you feedback on what you're trying to do. And then you'll finish by presenting your solution. Now, the channel that I mentioned, Discord, is where we're having our event and where teams are forming. And it's a really simple approach. There's different groups that you can, or different channels, I should say, within Discord, where you can be welcomed, you can ask questions about the event, you can learn about the track themes, pitch or join a team, and then we will, as teams form, we will give you your own channel so you can talk with one another and text together on that channel. Final presentations on Saturday are made up of a short 3-minute presentation that the team comes up with. You'll have some Q&A with the judges. They'll score you, and the best teams will win. So I know I'm going through this kind of fast, but I just want to give you a snapshot of how we're running this. The judging criteria is pretty straightforward. This is also on the website. You can look into that, and also the prizes. So we do have some cash prizes for our finalists. We also have some wonderful in-kind prizes, up to $10,000 credits per month with IBM, and also some office space that we're valuing for the winners. So a lot of motivation to be involved and to enjoy this event. All right, well, I'm going to go ahead and turn it over to our speakers that have joined us. We'll start first. In fact, I'm going to stop sharing for just a second and give our panel a chance to get ready. But it's good to see everybody. It looks like we have about 20 or so on the call. You're welcome to turn on your video so we can see you as we have our Q&A, and you'll be able to raise your hand and make some comments. But J.C. Adams, just a little bit of background on him. He, like I had mentioned, he was involved with Health Wildcatters many years ago, and his company is based in Austin called Cloud9, and they have a strong focus and a mission on working with behavioral health technology and access, and also putting together experts to provide telehealth solutions in the market. So they're based in Austin, and he actually has a recorded talk. He's with us virtually today. So I'm going to go ahead and play that so that we can hear from J.C. Adams. So give me just a second while I get that geared up here.
Hello, everyone. I'm J.C. Adams, founder of Cloud9 Telehealth. Thank you all for joining and participating in this Texas Healthcare Challenge. Hello, Health Wildcatters, and hello, Hubert. Wow, I miss those early wildcatting days, working out of old churches without much heating and air conditioning, and before having a Slack channel when you had to communicate with us entrepreneurs by yelling at us with a handheld bullhorn. I miss those good old days. And thank you, Lance Manning, for putting this all together and inviting me to speak on this subject of mental health. Actually, 4 subject areas of this event is relevant to our work here at Cloud9. That's telehealth, mental health, but also rural health and improving access to care. So our company Cloud9 works to address all four of those with our solution. And our software is differentiated because of our ability to deliver collaborative care, as well as leveraging user data and systems integrations. So also our customer's mission is to deliver care to underserved, vulnerable populations, many people who are low income, covered under Medicaid, or even uninsured. And our clinical focus does still remain on patients who primarily have a mental health or behavioral health diagnosis. And the reason why is there is lots of room for improvement with our long neglected US mental health care system. Some problems include that 80% of patients that have a mental or illness or substance use disorder also have chronic co-occurring physical illnesses, which cost the US $420 billion each year. Now, 35% of that can be saved in populations by simply integrating mental health treatment. So another issue is when these issues are left untreated, we get big problems in society. For instance, medical emergency rooms get flooded, jails and courts get flooded as they become the dumping grounds for mental illness. And this is a failed cycle of non-treatment and readmission that wastes $32 billion annually. And really, our nation was in a mental health crisis before the coronavirus pandemic hit, as our country struggled with a shortage of funding, facilities, a shortage of mental health clinicians for decades. And, you know, there's another troubling statistic, which is human life expectancy. You know, it's been steadily rising globally and steadily throughout history, except recently and with one country on the planet. Starting almost 20 years ago, in the early 2000s, United States life expectancy, primarily among white Americans, has started to decline for the first time. And researchers discovered that this decline is due to what's called deaths of despair, which are attributed to increased rates of suicide, opioid overdoses, and alcohol-related illnesses. These are untreated behavioral health conditions. So now, with coronavirus and other societal problems of 2020 that continue here into 2021, these have exacerbated behavioral issues even more. And we have higher rates of illness and crises that are on the rise. One example is our national suicide prevention hotlines saw an increase in call volume from 2019 to 2020, an increase of 890%. So the good news is that public awareness of, you know, this massive problem, it's at an all-time high, and people are ready to fix this. And the healthcare industry has really grown to realize that really there's no health without mental health, and payers are aware of the long-term cost savings and the opportunity to be more proactive with preventive care services, and they're willing to pay for those these days. So the time is right for mental health care innovation. And I hope you're all ready to hack away at this challenge. So what I thought might be helpful would be to share some examples of some innovations that are leading the way and are actually working in the real world today and making impact. So I'll share some images and some ideas here. Let me get out of the way. And what you see here is a snapshot of solutions that these just hit my inbox from this arrived from Influence Partners. Although I think this chart was originally created by What If Ventures, but it's a good snapshot of viable solutions in categories which include digital therapeutics, telehealth, applied artificial intelligence, peer-to-peer services, and enterprise solutions. So starting with some of these that I've seen and followed over the years, I would say that in the area of digital therapeutics, one that I really like is Pear Therapeutics, which is, at its roots is a cognitive behavioral healthcare solution, but they do this in an automated fashion. You know, this is a process that can be automated. You don't have to have a clinician, and therefore it's scalable. And since and recently they've expanded into treating things like insomnia and opioid use disorder. Something else that's a digital therapeutic is virtual reality and augmented reality. Here's a company called Trip. That's quite a trip. I've met these founders at a conference and an accelerator that I'm a part of in the Bay Area. And I've come across their product on the Oculus. It's advertised pretty heavily. It's taking off. It's doing well. But in essence, what VR and AR can do is it can really help with things like, let's take post-traumatic stress disorder. There's something called immersion therapy. And when you use something like this, someone can go back and experience something again and reframe it and help rewire how this moving on to the telehealth category. I have a bias toward this because it requires human interaction. Call me old-fashioned, but I'm not quite ready for the robot therapist myself personally, or AI automated empathy. And I think a lot of other people feel the same. So you're probably aware of companies like Teladoc and American Well. But one size does not fit all with telehealth. For instance, you would not use your teledermatology app to have an appointment with your oncologist. But yeah, in the behavioral health category, this company here, is a great example. They've come a long way and done some great things with partnerships and product additions. Also, our company Cloud9 is included in this category. This is that integrated care collaborative model that I was talking about. We allow these individuals with complex needs to be surrounded by a care team. So your mental health care team can collaborate with primary care, substance use recovery specialists, social services. We can intervene with home health care or first responders in a crisis. And that's what we need, is to surround a patient with a digital safety net. And it also helps that we serve people that need it most. So we're a social impact company. And moving on to applied artificial intelligence, check out this company, Uper. They've been doing well and showing strong results with AI conversations where you're speaking with AI, but you can actually show improved mood and outcomes by doing so. Another company in this category has a cute name, Wobot, but yeah, this little Wobot has some pretty big audacious goals, and they're making quite an impact, even though they're at pilot stage, but they're starting to serve adults, adolescents, as well as substance use disorder, and they're coming out of pilot phases for each of these categories and into commercialization stage, and getting some good results. So keep an eye on this one. Check it out. Moving on to the next category. This is the peer-to-peer category, and I like this one again because it requires human interaction. However, it doesn't require a licensed clinician. So this solves the supply-demand issue, solves the access barrier issue. It brings costs down for certain individuals. So what's nice about this is that there are a lot of different ways that you can approach this. And this particular company, Everyman, is geared toward men. But they have peer support groups that are geared toward women, as well as LGBTQ. And I really anticipate that eventually, for every type of lifestyle and culture imaginable, you'll have peer networks that are there for you. And these are individuals with lived experience that have overcome their mental illness or addiction and can help show you the way. And they're proven to be very effective. So this also exists for other types of diagnoses. So here's an example of a leader for substance use disorder called Sober Grid. And yeah, there's a lot of ways to do things in this category. I'm even working on a new project that we'll be announcing soon. It's a new model for all types of peer recovery networks. It's a way to better engage the peer support specialists and incentivize them. So this is an interesting category. Yeah, and if you're interested in this category, reach out to me. I'll put my contact information up here at the end. And then finally, the last category is enterprise solutions, B2b. We're big believers in that. it's a way to make impact is by reaching the consumer through businesses. Here's one I like. It's called Wheel. It's where employers can engage with their employees to reduce stress and improve employee performance by using these daily sessions and science-based mini courses. Another company to check out in this category is Hapify. Been around a while. And, this is one of those stories of a company that started B2C. It got traction and then realized, there's only so far we can go with our particular model here. We need to work with the healthcare industry. We need to work with payers. And they had to go and reinvent themselves and pivot. And they did so successfully. So, I think this actually is a good way it's an important point to make as you begin this Texas Healthcare Challenge and you start to hack at solutions, is keep in mind that there's many well-intentioned entrepreneurs out there that have wanted to change the world and who have failed because their good ideas were not financially sustainable. Change is something that often cannot be sustained by donations alone. So within our monetary system. So forget the mission if you cannot first design a sustainable business model to support it. So that's how my company finally found market fit, is by proving that it's cheaper to provide people healthcare services than it is to, let them flood inappropriate facilities. So as you enter your challenge, I wish you the best of luck, and I'll leave you here with my email address. Feel free to reach out with any questions about your problem and solution fits, and any questions about the industry in general, or questions about Cloud9 opportunities, as we're recruiting right now for technical and business development talent. But for now, get to hacking and do so with moonshot thinking. Set audacious goals and don't try to copy these market solutions that I shared today. Instead, let them inspire you. And start with a blank page. Create your own solutions, if not your own category. And as you find your problem solution fit, I recommend you take the advice of our new Texas resident, Elon Musk. And what you do is you work like hell and you never, never, never give up. Take care.
Okay, thank you very much, JC. We will continue with our presentation here, but let's just talk a little bit about what he's reviewed. One of the reasons we're doing this info session is to help you as participants in this weekend's event to think about the problems that are out there in mental health, and ways that you may be able to come up with some kind of a solution or team up and come up with the company possibly. So, as I think about what he talked about, there's some really interesting statistics out there. Obviously, there's a huge increase in the number of people who are accessing crisis hotlines. There's a huge demand and low supply of caregivers. He mentioned the peer support type of solutions that are available on, on the various apps. I have tried the Wobot. I think that came out a couple years ago. It's basically you text to this automated system, and it has a lot of intelligence and AI behind it, based out of Stanford. So that was pretty cool. All of the links that you saw in his presentation, we are going to list those in Discord. So if you want to look them up, we'll make sure that's available, as well as his video that you saw. So, it's really interesting. I've had some other conversations. I have a surgeon friend here in the Dallas-Fort Worth area who has been doing a lot of organ donation and organ transplant surgeries. The unique angle to that, though, is he says it's been mostly teenagers, which is very, very sad that this mental health tsunami in this last year has seen an uptick in teenage suicides. So, definitely something to think about as we consider the COVID lockdowns, and of course, hopefully things are getting better now. But anyway, I'll stop, going off on this in this direction here. And I do want to introduce our next speaker, Amy Looper. She leads the company 117 Media, and She has a wonderful experience as a social venture entrepreneur, having had an IPO exit a while back, and I'll let her talk about that. But what I really like about her company and what she's doing is she's built a telehealth platform focused on kids and preventing potential school shootings and multiple youth suicides. So, very much having a pulse on what's going on out there. So I'm going to turn it over to Amy. Thank you for joining us, Amy, and we're excited to hear what you have to say about mental health.
Hi, thanks, Lance. It's great to be here with all of you guys, and I'm really excited to hear JC speak. He really outlined a really great overview of the industry as it looks for adults. So at this point, why don't I screen share, and I'll just get in and talk a little bit about 117 Media, and then look forward to question and answers on the other side. Does that sound good?
Yep.
All righty. Okay, let's see. All right, well, it's great to be with everybody tonight. I really appreciate you being here to learn more about mental health, and I'll just get right into it. So let's see. There we go. Let me click here. Yeah, single page. Okay. So Rethink, it's our telemental healthcare platform that uses a unique combination of smart chatbot companions paired with live chat therapists to provide personalized mental health care for kids ages 10 to 18. And Rethink, it's so powerful, it has already prevented a potential school shooting and multiple teen suicides. So here's the problem that we're looking at. Our kids are in the middle of an epic mental health crisis, and COVID-19 has literally magnified all of these problems. And we're starting to see even these problems surfacing for kids that are considered resilient. Stigma is still a big impact factor. It delays identifying kids that are in need. Plus, access to quality care is inconsistent at best, and too frequently it can take months to get an appointment with therapists for kids. The lack of mental health care providers, JC touched on this. There's a huge problem with providers these days. All of these things amplify the problems that you're seeing on the screen there. I was shocked even when I found this statistic, but there are 17, that's 17 adolescent psychiatrists per 100,000 kids in need. That's just really shocking. But that said, out of adversity comes opportunity, and this tsunami of demand for more adolescent mental health care gives us an opportunity to provide both outcome-based and data-driven mental health care tools that'll solve today's problems to reach youth at scale. So on the screen there, you're seeing a couple of screenshots of our dashboard. We're using machine learning to parse out lots of data to understand exactly what kids are thinking and how they're feeling. So I'll give you a little deeper dive here, but the welcome screen on the left-hand side there introduces Minty, our mental health care chatbot companion that kids can carry with them to use anytime, anywhere, to get the mental health that they need on demand. So let's look at sweet little Joaquin there on the right-hand side and use him as an example tonight. So based on what his mom Tammy shared with us during the registration process, Rethink it's already preloaded for Joaquin personal content that's personalized to some of the challenges that Tammy had already set up for us about her son. So right from the get-go, when Joaquin logs on the first time, he already sees content that's meeting his needs. So going forward, the more we learn about him over time, of course, the more customized his experience becomes. And equally important, we're tracking and ensuring that he's actually making progress over time. So now the center screen there is an example of our live chat therapy. So Mom Tammy's already matched a therapist for Joaquin from our network of certified adolescent therapists. So he's good to go with Christy there. And down at the bottom, you'll see what we call our emojiometer at the bottom of that screen. It's actually a Likert scale. And we have Likert scales embedded throughout all of the content that we have, in addition to other tools to measure Joaquin's emotional state throughout the use of the entire app. So after this session, Christy will ask how Joaquin's doing, and then we'll be able to compare. And it looks like, because it's red down there, that he was very unhappy, but I can say that in the case study, he feels better after he has his chat. So the right-hand screen is uniquely proprietary to us and Rethink It. It's our evidence-based 17-question assessment called What's Up? So kids can see it as a highly engaging, interactive, chatbot-driven conversation, but it's paired with college-age video mentors who walk kids through in this part of the app to get their side of the story together on anything that's on their minds. So they can come in, as you saw, if if they're muddled or mortified, they've got a problem, they're puzzled, those things rotate out to keep the app fresh for kids and then we'll take them down the path that makes the best sense for them. If they're puzzled about something, they'll go down to the path with those 17 questions. And then based on how they're answering, there'll be some dynamically generated additional questions to gather more information. So our algorithms are working together with select IBM Watson AI tools to provide this uniquely comprehensive and what we call an emotional digital triage on kids' social and emotional well-being as they use the app. We also gather, this is interesting, on average, 5.4 emotions that kids are feeling about the particular challenge that they have that they're talking to us about. And that's generally 5.4 emotions compared to generally 1 emotion that kids usually give. If you ask them how they're feeling, they may say, oh, fine, or I don't know. So that's very insightful. And we also get an additional 6 times more information than a child will share face-to-face with adults. And those 2 pieces of data right there are significant because kids very often will not take the risk to share what's on their mind, especially if they've got a problem, because they're afraid they may have more technology taken away from them. Punishments might be great. They feel like their words get twisted. There's a whole host of reasons that we really want kids to talk to us in a safe way so that we can get more information before things go off the rails. So I've already mentioned a few of our evidence-based results, so I'll just kind of skip down to the business case of managing kids' mental health in schools. 80% of kids are likely to get their mental health care needs met in schools, which is really interesting. So it's imperative that schools beef up their counseling. Right now, Texas, for example, out of the 50, there's 50 states plus the District of Columbia. So 51 out of 51 states plus the district, Texas ranks 50th. So it's really bad here in our state. And that means that there's about 880 health professionals or counselors per child. So it's staggering. You can see why mental health issues actually get out of control, because there's just not the safety net of professionals there to help kids in the very beginning. So one of the things that we've been able to, and this was kind of an unexpected positive consequence when we fired up Rethink It for schools, is that we were able to reduce in-school suspensions by up to 77%. And that's a really big deal for schools. And one principal called us after she had used the product for 9 months. She had gone through all of her expenses, and we had preserved over $100,000 of monies for her, because we had decreased her in-school suspensions and her alternative school transfer rates by 77%. So when a school transfers a child out to either another facility for alternative school, or they sit in school suspension for 3 days, that adds up. It's a lot of money. So that's real return. That's real dollars, real money return on investment, as well as a really powerful social return on investment that we all take a lot of pride in here. So I'll close with this. These testimonials underscore the difference that Rethink It makes in kids' lives. So looking deeper at what kids really are saying with these comments reveals that we found a successful way to use high-tech, high-touch to value and validate them. They find their voices, they feel listened to, and Rethink It has actually literally changed the trajectory of many, 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 many kids' lives. And one of the stories I like to talk about is the gang leader in one of the largest schools in Houston. Actually, we prevented him from going to prison, and he graduated from high school just by using Rethink It. So those are the kinds of stories that get us really excited. And that's why our team loves to come to work every day to build those kinds of tools to help kids thrive. So what I mean by hacking on purpose is this for you guys. Next weekend, when you're putting your teams together to solve a problem, think about how your solution's purpose is going to really change people's lives for the better. And you all will be startup rock stars. All righty, thanks.
Okay, thanks so much, Amy. If you want to just unshare your screen, or we can go back to the video here. All right, well, to ask a question, just go ahead to the reactions and click on raise your hand. And I see a couple that are out there, and I'll get to you as I just make a few comments. So Amy, for the benefit of the audience who are going to be going into this event, I'd like for you to think back to the initial problem description that you and your co-founder considered as you started your company. Was that on a paper napkin? Was it from a conversation? Where did the origin come from? And can you recraft the problem statement that started your company?
Yeah, thanks. That's a really great story. I'll try and make it really short, but Beth and I, this is probably our fourth business together. And so for the last 30 years, we always make sure that we give back and do pro bono work wherever we can. And that's where the initial idea for this business, for Rethink It, came, was from way back in 1992 when we did a pro bono project for a mom who had three boys that went to a middle school in Houston. It was a tri-ethnic school, and there were a lot of problems at that school. She was a writer by training, so she wrote inspirational messages to have read aloud during homeroom. And just through our network, she needed some marketing, and so Beth and I were introduced to her. And that was when we learned about the fledgling field of character education. And, you know, I'm a Texas born and bred girl, and character education in my household was yes, sir, yes, ma'am. I'd have to write in my Big Chief tablet with my number 2 pencil if I slammed the door. I did not know what character education was. And so I was really intrigued by that. Fast forward, after we did that for her, in 1999, we took a technology company public, and there was some publicity in the newspaper, and she reached out to Beth and said, hey, I know you guys aren't going to sit on your laurels. I've been working in schools now, and there's a problem. And at that time, the Houston Independent School District had about a 35 to 40% dropout rate. That meant that about 80 or 90,000 people, I think, filled the Houston, Texas arena. That's how many kids were not graduating in the Houston Independent School District. So our thesis came out of that after we heard that the dropout rate was really bad. And this problem was there. So our thesis was really simple. Can we help kids be better people using technology? It was sort of, where is that intersection for us? Can we help kids with their character education? And by then it had kind of morphed to social emotional learning. If we could help kids in some way, then that looked really interesting for us. So that's really how the idea came about. And I think I'd gone through a driver's ed, an online driver's ed class, but also in our technology company, we were building back-end training systems. So for example, we built Continental Airlines' first online ticketing system. So there needed to be some training on the back end. So my particular group was handling that. So I was familiar with computer-based training, and having taken online speeding ticket training, I thought, well, I wonder if we could use, so the question was, I wonder what's being used for adults in that sort of way that we could basically use computer-based training to help kids when they got sent to the principal's office. So we started to work it down, is where is that first point of care or point of need that kids had? And that's how the idea came about.
Wow. Well, sounds like it's been a interesting journey for you, and a lot of creativity and talking to different experts. But that's a startup journey, is trying to find your way and find that niche. So I've got a couple other questions, but I'm going to go to the audience here. So if you have a question, please raise your hand. The first one comes through chat, and it's more of a product question, Amy, and it says from Dr. Yolanda Lawson, what is the age range Rethink It is geared towards?
It's actually, the sweet spot is middle school, very specifically. However, we say ages 10 to 18. Mostly because of the dexterity now for kids to text, but we have had second graders on it. We actually have an MVP for pre-K to second grade. Texas passed a law a couple of years ago that they could not put pre-K to second grade, kick pre-K to second graders out. They were suspending those kids instead of dealing with their behavior. So we do actually have a full life cycle, but Rethink It is primarily in that 10, 11, 12, 13 age range. You can see just by the look and feel, it lends itself to a younger crowd. But I don't know if those of you from Houston are around this area, but we were told that we didn't think high school kids would click with it. And so we did a pilot with Galveston Ball High School, a very small place, but that was a relationship that Beth had with the principal there. And she was not a believer. She's like, okay, well, I'm just going to do this because I'm friends with Beth. And so we launched, and oh my gosh, it was really successful. So I think what it proves for kids is that they appreciate that we're using technology that they already use for everything else anyway. It is not an adult being in their face saying, so Amy, how does this make you feel? Kids are not going to do that. Yeah. So it's just interesting. And I think it really shows that the need is there. And a lot of kids want to express themselves. They want help. And this is a comfortable venue for them to do that.
Great. Next question is from Joseph Trevino. Was FDA approval required for your app?
No. And that's a really good question. It was not approved or not, was not needed for approval for our app. But when we started, the very first iteration was back in 2000, and it was all online. And when we started, because we were in Houston, we had a relationship with the Houston Independent School District, and they graciously allowed us to pilot. And one of the first things is we were striking the criteria. We were asking, okay, do we need to have this approved? And, do we need to have research? And they're like, oh, no, we don't need to have any research. And for us, as a technology company and having KPIs or key performance indicators and metrics that you prove you're doing what, we were just like, what? But at that time, it was called social emotional learning, and they just didn't feel like they needed that. That changed, though. We went on ahead and started a 2-year research project along with our pilot, because we wanted to prove that efficacy and really show strong outcomes. And I'm glad that we did, because by the time we got through with the first 2 years, then it was like, oh, do you have that research? And it's like, yes, we do. So yeah, it's interesting, but that's a good question. Yeah, in this case, no.
So a regulatory body, hoops to jump through wasn't needed, but you did some studies that you self-published that could give credibility to where it was requested.
Right, exactly. So we show statistically significant reduction in children's emotional distress. And I say it that way because that's what I'm not a researcher, and my researcher said, that's how you need to say it, Amy, whether we show statistically significant research that we can reduce kids' emotional distress. And that's really significant because it's actually called our affective domain. So it affects all of us. If we have an argument with our significant other before we leave the house, we may be upset about it, but as adults, hopefully we get to work, we can kind of work it out, and then we're going to take care of that situation when we get home. As I've been learning with our clinicians for kids, when I see my BFF down the hall and I think he's stealing my boyfriend, then I'm all upset. And my affective domain, when it shuts down, there's no way as a child that they can sit in class and learn algebra. So that was really significant that we were able to, with Rethink It, and on average, kids spend 26 minutes telling their side of the story. It was enough to calm them down. They could, about 94% of the kids that were coming through in-school suspension using the program were taking responsibility for the behavior that got them there. The issue got taken care of in 30 minutes instead of a child sitting on the bench for 3 or 4 hours or going to in-school suspension for 3 days and getting farther behind in class. And then anecdotally, our customers were telling us, I saw little Amy come through here. She was a D student, but I haven't seen her in in-school suspension, and I noticed her GPA's up. So, it's just interesting where data, I love data. I'm not into math or anything, but I really do love data. And researchers, God love them.
Okay, a couple more questions. We'll go to Whitney, and then we have one from Patrick McCauley. So Whitney's question in the chat is parental permission necessary for your app?
Yeah, that's a great question. And there's 2 parts to that. So we have been focusing on schools. And what's unique about us being in schools is that schools already have all of their permissions, all of their protocols already established. And we are simply a software product that when the data that we collect, so we do collect data, but it's all anonymized. We don't know that it's, who it is. We just know, okay, there's a boy in 6th grade, at this school that was in detention and went through Rethink It. So the school then manages all of their data on that side through their dashboard. They know who it is, and they've got all the permissions already taken from the parents. So that's been really good for us as a business because our security is there, but we didn't have to worry about HIPAA or COPA, which are all those other things. Now, last year, we were looking at, because of the rise of employee benefits, we saw that as an opportunity to, well, if I can, I'll add one piece. Sure. So the research that we were doing in schools, anecdotally, we were seeing that kids, we were reducing this in-school suspension by 50%, which we were able to create a hypothesis. It's like, well, if 50% of those kids are not going into in-school suspension, and there was a percentage of those kids that then their parents had to be called, and their parents had to leave work and go and take care of their kids, that we began to see was an impact on the employer side, as well as on the parent side. And in a lot of schools where there's a lot of need, those are parents that are hourly wage. So if they have to leave to take care of a problem, now the family's losing money. It's just a whole chain reaction. So last year, employee benefits have really started to take up that uptick that companies will pay for those benefits. And so that's actually why we went to Health Wildcatters, was to explore that concept. And that was it really has legs, and we're still doing some work there. But then COVID hit, and that slowed things down a little bit. But still, we're seeing the need is like a hockey stick. It's just still going up. So that background, thank you for letting me share that. So now it's not going to be FDA, but now we will have to have parental permission. So that's opening up a whole new side of our business for security and those kinds of things that for kids to come on. I think Texas is 18. You have to be 18 if you're an emancipated child. And again, this is really area I shouldn't really be talking about. So double check anything I'm saying right at this point. But I think if you're 16, you can, with some criteria, you can get telemental help on your own. But for all intents and purposes, we're going to say we need parental permission and just roll with that and go from there. So,
Great.
but yeah,
Okay.
that's a
awesome question. All right, so we have Patrick McCauley up, and then we have time for one more question after that. So if you want to ask, Dr. Lawson will be the last one. Patrick, your question, you can go live on video or audio. Go for it.
Sorry, I'm working, so I'm about to go audio only. But thank you to everybody for the presentations. But I had a question for Amy specifically. Since your platform has both AI and some human connectivity on it, I was wondering if you've been able to split apart the impact for, are the kids getting just as much out of the AI interactivity, or is it putting them together as a peanut butter and chocolate component, or do you have any thoughts on one versus the other?
We don't have that research in at this point. Right now, I couldn't even guess, and I wouldn't want to. We need to look at the research. So that's a really great question, and it's something that we're tracking to see. I will say that our lead clinician, it's been interesting learning from her how she's interacting with kids that use the app, use WhatsApp, and then the way that she then will have sessions with them. So the WhatsApp module with the chat bot with Menti simulates a texting setup, right? And of course, then our therapy and live chat, that's the live chat. It seems like that kids just click on both ends. The WhatsApp module allows them to get their side of the story and all their thoughts together. There's an emotional, I mentioned we get 5.4 emotions. So there's like a list that they can click on their emotions. That's been weighted with our engineers and clinicians, that if a combination of these emotions come through, I didn't know this, but there's a list of a certain set of emotions that if kids exhibit, then that will put them in a red flag setup that they might be suicidal. So our algorithms have been weighted to help with that. Now, what we're seeing is if kids are ideating, suicidal thoughts when they go through the WhatsApp app, then the therapist is able to see that very quickly. We have kind of like a whole workflow process on the emotional digital triage, basically green, yellow, red. And then they can jump in and really quickly have those conversations with kids. So that's a longer answer to answer that. Until I see the data, I don't know, but we know that they love telling their side of the story, and they love having these short blasts of text messaging. So that's a really great question. And I look forward to getting back to you on the answer.
Great. Okay, thanks. All right, our last question, Yolanda Lawson, and go ahead. We're almost out of time, so I'm going to ask our panelist Amy to cap her answer to about 1 minute. It'd be a challenge to do that, but we'll get it done. Yolanda,
Okay.
Go ahead.
Okay, great. Thank you, Lance. Great presentations for both of you. Both of your companies appear to be niche, in my opinion, which is good. But could each of you just briefly tell me who's your target client? For instance, Ms. Looper, is it schools, families, mental health professionals? I'm having a little bit of hard time figuring out your niche and who do you market to? How do you gain business traction?
Yeah, that's great. So we've been selling to schools, directly to schools. We've also been approved by Google. So now we're going to be able, through Google Education, just through an API, we think it will be there. And so any schools that need help, let's just say for trauma-informed or social emotional learning, they can go into Google and they can click on that category, and then our product will come up, and then schools can just buy it and download it. That's going to really help us with sales, because really, y'all, selling to schools sucks. It's really hard. That's one piece of it. So schools right now are our primary resource of revenue, and it's a licensing agreement that we sell with them. Now, for employers, for employee benefits, that's going to be more of a package that will be set up within their human resources and their wellness platforms and benefit platforms. That'll be right at the moment. It looks like we'll do flat fees just like everybody else in the benefit space is doing. And then we have the ability to go out directly to consumers, but right now we've kind of parked that because that's a whole different ball game. Was that helpful?
Yes, thank you very much.
Thanks. Great question.
Great. And since JC Adams is virtual, I put his email into the chat. If you want to email your question to him, that's there. So we thank everyone for being on the call tonight. We're grateful for the questions that we heard from you and the engagement. Very much appreciative to our speakers, Amy and JC, who volunteered their time and their expertise to comment on this very important topic. So, mental health, we are grateful that you joined us, and that, hopefully you'll be pitching some problems and ideas at our event. Now, we are going to transition off at this call, but for those who are registered for the event, from 7:30 to 8:30, we are going to be on Discord, and we invite you to join us there for some touring, some Q&A, and also looking at problem pitching and possibly joining teams. So if you are registered, join us on Discord. You should have a link in your email. But I want to thank everyone for being here, and we'll sign off and say good night. Thank you very much.
Good night. Thank you.